Hello and welcome to this episode of Plus Life, which looks a bit different because it was produced in partnership with AIDS 2020 Virtual. Here is our interview with the one, the only, Dr. Anthony Fauci. Dr. Fauci, great to see you again. I know you're a busy man, so thanks for taking the time to sit down with us for AIDS 2020 Virtual.
Good to be with you.
So let's dive straight into this. Based on the evidence you have seen so far, do you think that COVID-19 is affecting people like myself, people living with HIV, differently than those who are not living with HIV?
So far, there is no evidence that there is a substantial impact on people who are in the class where they are living with HIV, but they're on therapy, their viral load is suppressed, and they have reasonably good CD4 counts. I think that you can make a projection that for those, and unfortunately we know there are many, depending upon where you live and your access to care, who are living with HIV, but who have a substantial degree of immunodepression. And if that's the case, although we don't have data to say that they are going to advance to more serious COVID disease if they were to get infected with the coronavirus, I think you can make a reasonable assumption that they would fall into the same category as people who are on immunosuppressive drugs, for example. So I don't think for someone who has the capability and is implementing it of getting their situation with regard to viral load under good control, I think we'd be okay.
That's certainly reassuring to hear. With the way this COVID-19 pandemic has taken over the world, and is certainly eating into resources, how concerned are you that this is taking away from key HIV research and study?
Well, I can tell you we're not getting off track from two standpoints. When you ask that question, I think it has two components of it. One, are there resources that would be going to HIV that are now being diverted to COVID-19? And then the next question is the activity for getting resources that people are doing, is it being diverted towards COVID-19 and away from AIDS? With regard to the first question, there is no doubt, there is no diversion of resources that are AIDS resources, AIDS dollars, to actually divert away from HIV/AIDS. No doubt about that. In fact, there are so many resources because of the emergent nature of COVID-19 that in some respects there's COVID-19 dollars that are being put into situations that might ultimately, in the long run, benefit HIV/AIDS. So, because they'll be base dollars. With regard to activities, the AIDS activities are going on. Literally, I just got off a conference call looking at the projection for monoclonal antibody studies for various stages of the different vaccine candidates. So HIV/AIDS is in good shape. We are, however, and I want to be transparent about this, using what we built up for the clinical trials network, the infrastructure, the capability, the experience that our HIV/AIDS investigators have in designing clinical trials and implementing clinical trials is being used to help this new field of COVID-19. So the AIDS enterprise is making contributions very much in an intellectual way to how we address COVID-19, but it's not diverting the activity away from AIDS.
I like also the fact that it's not just the intellectual contribution, but the social contribution and the lessons we've learned in the fight against how we treated those from a medical standpoint, but also from a humanitarian standpoint, from the darkest days of AIDS to how we are treating people in this pandemic, right?
Oh, there's no doubt about that. As a matter of fact, I've actually given interviews on just that topic of how we've learned about engaging the community, which it took us a while, but we had it so successfully done now. In fact, I'll tell you something that I think the HIV/AIDS community should be proud of. The things that we did over years of developing community boards, when you develop protocols and how to engage the community so that people get engaged in clinical trials, that what they do is transparent and understanding and input. So we got called and said, how did you guys do it with HIV? And we told them how we did it. And we're using that model now as we prepare for vaccine trials and therapy trials.
When we come back, more of our interview with Dr. Fauci